Hey everybody, it's Matt Shue from Upright Health. I'm here with my buddy Josh Hash.
What's up, guys?
Today we're going to be talking about the psoas. Is the psoas actually causing all of your pain? We hear this all the time, right?
Hip flexors, man.
It's always those hip flexors. There's like hundreds and thousands of videos about your hip flexors causing your back pain.
Right.
Does it always cause your back pain?
No.
No, it doesn't always cause my back pain either.
Right.
So today's video, we want to talk about back pain and give you a quick example of ways you can test different things that could possibly cause your back pain. So Josh and I have counted roughly 17 different things, maybe more, maybe hundreds. We're not sure.
It's still going up.
Still going up.
Yeah.
So we're going to start by giving you a really clear example of a client that we worked with. So Mike, this is going to be Mike today. Mike was having a bunch of Big Mike was having a bunch of lower back pain. So when he was sitting down, he was having trouble tying his shoes. So he would lean forward and then he would get this pain all in his lower back. So what did we try?
Put on flip-flops. That's the first thing we try.
I told him to move to San Diego where you can wear flip-flops all the time, all day, every day. And then we had him try different stretches. So we had like hip flexor stretches.
Okay.
So check it out. Is that a hip flexor stretch? Yeah, that's a hip flexor stretch.
That's a hip flexor stretch.
Yeah.
Right.
Kneeling. Boom. Boom. Got that one. Got that one. Are you squeezing your butt back there? Oh, man.
Squeezing the butt.
Are you ever?
Posterior tilt, all that good stuff.
Oh, man. Big Mike will be jealous. All right, so they did that. No real help. Did some hamstring stretching, right? Because sometimes maybe the hamstrings are causing problems and we want to make sure the hamstrings are loosened up. Did that for weeks, couple weeks, and did it help?
No.
No help for Big Mike.
Still. Can't tie the shoes.
Still couldn't tie the shoes, and the hamstrings were getting looser, obviously looser. Hip flexors are looser. Quads, we did some quad stretches. We even did a bunch of like spinal mobility stuff, training that up. So like the T-spine, the quad T-spine rotations. Another fun thing to try to kind of get your back muscles to loosen up, get your spine to be able to rotate. Look at this. This is beautiful. This guy knows how to move his spine. So we did some of those. It felt really tight around his rib cage, but did it help? Not really.
Not really.
So we did cat-cows. We did some of those. We did prone cobras, cat-cow like that, going flexion, extension. It was hurting in both directions. He tried doing cobra. He was doing that actually every day just as part of his normal kind of exercise routine. And he could do that without pain, but it still wouldn't actually make his back pain go away. So all these different things, the hip flexors, the spinal muscles, moving things around up and down, and it didn't solve the back pain. So what eventually did solve the back pain? Big Mike, let's get back to the chair. And let's show everybody what worked in this one of 1,700 different options. So in this case, every time Big Mike kept leaning forward, his lower back would start to hurt, and he'd say it felt like super, super, super tight just in the low back. Let's actually have you spin around. Let's do like a cool movement where you're just in a half squat and you're facing that way so they can see the low back. Facing the mirror there so everyone can see your low back. Keep going, keep going. Keep spinning around. Keep spinning. Use your lizard-like skills. So right in here, this low back area. Keep turning. They want to see your They want to see your underwear.
360
They're
turn.
seeing
Okay.
it. Yeah. So that area right there, that low back, the spinal erectors, for him, were just feeling super tight. So all we did that actually ended up solving the problem after weeks and weeks of different kinds of experimentation for him was just start massaging in on the lower back muscles. It's not that complicated. It's also not really that dangerous because there's nothing you're going to really crush here unless you weigh 700 pounds and are pushing on somebody's low back. And you just lean into the muscle there. Just nice and easy, a little gentle pressure in there, a little more in there. And for him, it was pretty painful. He was like, oh, gah, gah. Super sharp, super painful. But then we did that for 5-10 minutes. And then Big Mike got back up onto the chair. Well, for historical accuracy, he was
feeling pretty good.
Gonna go hit a few golf balls? Oh, Big Mike, I hope you're watching this video.
Oh, look at this.
Oh, look at that. So
Tying the shoes.
you tied them like you've tied them 100 times
That's
before.
nice.
So just by working on the muscles around the spine, just by actually putting a little pressure on it, it actually helped relax the back. Now, does that solution work every time? No. That's why we had Big Mike doing all kinds of other things beforehand, because we want to see, like, can you move? Can you control your spinal muscles well? if you can, that's going to set you up for better results. But if all that's not working, if stretching's not working, there might be something else going on. And for him, direct pressure on the low back muscles just released a whole bunch of the tension.
Yeah.
Right?
Yeah, and I think also just to add this in is that Big Mike, myself, has pretty strong core muscles too. So it wasn't a lack of, some people might jump to, oh, well, maybe his core is, a lot of people say it as well.
Right.
When the back pain is coming up, you got to strengthen your core.
Right.
That was not a problem with him. So yeah, experimenting with all these things, and just a perfect example of like, there's so many things that can cause something like back pain that you got to go through your checklist and you got to explore your body.
That checklist is like
right.
approximately this long. But yes, going through the checklist, hopefully that gives you an idea of, how complex it can be and also how simple it can be. It's not about necessarily like looking like, oh man, is something so damaged just because your hip flexor stretch didn't work or because your hamstring stretch didn't work. It's about looking for a really practical, simple solution to whatever is, dysfunctional and causing you pain. For him, it was just a little bit of direct massage work, and now he can do that with a lacrosse ball and just get in on the side of his spine, just on the muscles, and just gradually work that out. So hopefully that gives you some different perspective, a more helpful perspective on back pain, one that's less scary, that doesn't make back pain such a demonic, scary, horrible thing. And it gives you some ideas that you can work through in case your back is hurting. So we hope you liked this video. If you did, click on the like button here on YouTube. We want to take a moment to thank Christoph Leopold for his support on Patreon. Thank you so much for giving us your support and making a $5 pledge. It's awesome. If you haven't pledged yet on Patreon to help the Upright Health channel get ad-free, please think about it, right?
Do that.
Hit
that Patreon link.
Yes, it's going to be down in the description section. And be sure you subscribe to the YouTube channel if you haven't already. And as always, remember that pain sucks.
Life shouldn't.
If you liked the video, don't forget to like, share, and comment. And don't forget to subscribe.